Hi guys, so this is Tom Oliver, and we're going to be briefly describing what's been the marketing ground for the last 12 months of working together. So, Tom, without further ado, could you please briefly describe your practice, including your speciality, how long you've been working in the practice, and any significant shifts you've made in your business model, such as going all in for cash versus insurance, and what that looked like before we started working together?
Um, I made a shift. I'm a chiropractor, and I've done chiropractic and rehabilitation, been practicing since mid 80s. About 6 years ago, we decided to move into this specialty of neuropathy for personal reasons, but basically, we found it's been very rewarding in two ways. One, it's allowed us to move away from depending on insurance, and we're much more cash driven. So we've started doing marketing the last several years since we really got into neuropathy, and we've started to work with Marco in terms of doing Google work, things like that, and slowly been able to improve the quality of that work over the last year and seen good results with it since we started working with Marco.
And before partnering with us, what were some of the marketing challenges you faced, and what sort of led you to take a different approach? Maybe you can share some of your experiences with previous marketing and why you had to make some of the changes that you did in the business.
Well, we've done, when we first started out, we did Facebook marketing, which was okay, and
Yeah.
then like anything, algorithms change. And so that kind of changed the way we were marketing. We were doing some workshops at restaurants, things like that, which was,
Yeah.
again, okay. But again, it takes a lot of legwork. There's a lot, like anything, any advertising, there's some costs involved. You just want a good return on investment. So, one thing I've learned is it takes a while to kind of figure out what works in your market. Ultimately, we came to doing Google because and working with marketing with Marco because we felt like it was a better avenue to go down to be able to find the type of patient that we were looking for.
Like when you're saying that as well, you found it to be a bit more higher qualified with Google as opposed to Facebook because the intent level's different, right? As opposed
Yeah,
to,
yeah, the quality is much better
yeah.
using Google. And that's really why we went with it, because we really felt like it was a patient who was searching us out as opposed to just being presented with an ad on Facebook as someone scrolling through. So I think it was a different quality of patient.
Yeah, yeah, exactly. And so then what was the key factor that made you to kind of decide to work with us? Was there any specific aspects to the approach, say specifically with Google, such as, like we just talked about, focus on the lead quality or any of the initial conversations that kind of stood out for you?
Well, we got a referral to you, so that's how we found you. And the referral had real good things to say about in terms of you and being able to market in that direction. We had never done that before. So, um,
Everything was new for you at the start with Google Ads.
what's that say again? That what?
Everything was brand new for you with Google
Yes,
Ads. You hadn't advertised before on Google Ads.
we had not. We had not. So it was new. So we started that in the last year, and it's really been a very it's been good. It's been a great complement in the marketing strategies that we've been able to utilize.
Okay, now since we started working together, what are some of the more or the most significant results you've seen in the practice, both in terms of patient acquisition, maybe financial outcomes if you're comfortable, or could you share some of the specific metrics that you've observed change, such as what was your goals for how many patients at the start per month to where you've got to 12 months down the track in terms of how many closed patients you're getting?
I would say when we first started out about 12 months ago, we were averaging around 5 new patients a month. And now we've increased to probably on average between 10 to 15. So, I think in that respect, a lot of it's due to all the things we talked about, increasing the quality of our marketing, increase the quality of our staff, increasing the quality of the people we bring in. And yeah, it's just been great to be able to watch it, slowly grow consistently. And that's really what you're looking for in your marketing is consistency.
Yeah, fantastic. And it's also a big testament to you and the team and how well everyone's got the sales process dialed in at the clinic. So it's really a hats off to the team as well.
Yeah, absolutely. You have to give them a lot of credit. Before they get to me, there's a lot of pieces to that, so, and that's really all of them, and you in that respect, putting our name out there, putting our testimonials out there, making us look first class, and then following through with the people that get involved who are my staff, and then when the patient comes in. So it's every piece of that has to work properly. You only have a couple times to really impress a neuropathy patient, so you better be good.
And looking ahead, what is your vision for the practice's continued growth? Is there anything you see in virtually the future? What goals do you see yourself putting into place from here moving forward?
Well, I mean, I think the most important thing first is to be able to give really good quality care.
Yeah,
That's the number one thing. The second is, how do we do that in a way that makes the best sense in terms of return on investment, reducing the stress on the staff, and be able to achieve all those at one time. So, my goal is, we have some thoughts in terms of the way we're going to grow. But the most important thing is to make sure that where we're at right now, we don't have a real big staff. We have 4 to 5 people, so we function well within that, and we want to make sure that we're really, we're achieving the maximum result with the number of people that we have before we move on to some other steps. So that's where we're at right now.
that's great. Yeah, and I mean, I think that makes perfect sense as well. Like, utilizing the team that you have, and it's also, created a great lifestyle, then it means that it's not a lot of stress on the people or yourself. So
Right.
it's hats off to you guys.
Mhm.
So then lastly, what advice would you give to other doctors that are considering working with Google Ads and might be a bit skeptical based on bad experiences with bad marketing in the past?
Yeah. Well, I have had enough experience with bad marketing. So, I can tell you firsthand that, I know there's a lot of rabbit holes you can go down and spend a lot of money without a good return. I think the first thing you just have to be committed to your patient, be committed to doing the right thing, regardless of who's in front of you. 'Cause sometimes it's surprising, people, I think, who you think will never go through the treatment program, go through, and people who you assume would do not. So you can never make those assumptions. I think the most important thing is to be good practitioners, be really good at what you do first. And then after that, it's just a matter of, getting your best staff, educating your staff, and then really finding a marketing program that can deliver in terms of bringing quality people into your office. And I think, over the 6 years that we've been doing this, I think we slowly increased our quality and our ability to be able to do that. And I would tell you that, you have been a big part of that. Yeah.
Thank you, Tom. Well, I very much appreciate your time, and I'm sure there's other doctors that haven't met you or myself along the way that would get a lot of value over hearing your experience with marketing and neuropathy. So thanks again for your time.
Yeah, you bet.